We want to thank you for joining us tonight in person and on Facebook Live. We're joined tonight by some experts and a breast cancer survivor. First, to my right, I have Dr. Amy Case, who's the Lee Foundation Endowed Chair of Palliative and Supportive Care and the Palliative Care Program Chief at Roswell Park Comprehensive Cancer Center, as well as an associate professor in the Division of Geriatrics and Palliative Medicine at the University at Buffalo Jacobs School of Medicine and Biosciences. So welcome.
Thank you.
We also have Eric Hansen, who's an assistant professor of oncology in the supportive care and palliative care department here at Roswell Park. And next to Eric is Dr. Jeffrey Lombardo, who is an associate director of the Empire State Patient Safety Assurance Network and a research assistant professor at UB School of Pharmacy, who specializes in oncology and researching medical cannabis. Jeff also works as a pharmacist and botanist at the Medical Marijuana Dispensary. So we're going to start today with Ginny. Ginny Sukmanowski is a breast cancer survivor, and she's going to start this program off by sharing some of her experiences with medical marijuana. Ginny.
Hi, everybody. I started taking CBD I think it was January, beginning of February, and I bought it from my pharmacist because from my treatments, I was getting achy and had neuropathy, and I just, I just wasn't feeling like so great, just some of the side effects. So I started buying it from my pharmacist, and it didn't really help a lot, and I wasn't sure what it was supposed to do, but then when I was at the breast clinic I was telling my nurse practitioner and about how I was feeling, and so she gave me a script to see Dr. Case and for medical marijuana. And it was a process. It took a while, but I got it, and then I went to the botanist to get some CBD and some medical marijuana that was mixed together. And I took it, and they were great there. They were wonderful. They're so helpful. They answered every question I had. And it's a little bit of a journey trying to see what works for you and what doesn't. And I had to change some of what I was taking, and it did help. It did help, especially when you combine the THC with the CBD. It really got rid of a lot of the achiness that I have been experiencing. The big problem is it was like very, very expensive, but it did help. It did help a lot.
So you mentioned before about when you were working versus now. Congratulations on retiring.
Thank you.
But were you concerned about the effect of the medical marijuana on your ability to function at work?
Absolutely. So I took the lowest dose because I was teaching and I didn't want to go to school feeling the effects of it, especially the medical marijuana. So I just took some in the morning, and it didn't help a lot. I mean, it helped a little bit, and then when I would come home from work, because I called the people at the botanist, and they said, well, try taking it in the afternoon too, and I did, and it helped. It didn't get rid of the achiness totally, but it really did help. And what I did too is for about 3 days, I decided not to take it just to see how it would work. And I was so achy, and I know I was practicing. Well, I practiced Qigong every day, and I remember I was at a class and I was like, oh my gosh, I'm so achy because I hadn't taken it, because I wanted to see for myself how much of a difference it made, and it really does make a difference.
Just one last question. Did you have any side effects? I mean, any effects that you didn't want from taking it?
Absolutely not. No side effects at all. None at all.
So let's start with you, Amy. So what's the process like to certify someone to receive medical cannabis, and how is that different from prescribing, other medication that you would prescribe?
Sure. The process in New York State. Hi, everybody. Thank you for being here. I know there's a lot of questions about this stuff. We call it in the medical profession medical cannabis instead of medical marijuana. So I know that the name of the symposium is medical marijuana because that's the term we use for recreational use. But for medicinal use, we really try to stick with cannabis. So I'm just going forward, we're going to use that in case you're wondering what the difference between the two. It's the same thing. So in order to get certified, so the way it works is the physicians or nurse practitioners, any type of medical provider can take a training and have the ability to certify a patient to go and purchase medical cannabis from a dispensary. In New York State, there's dispensaries around, so you do not get it from a pharmacy, and a physician does not prescribe it. So the difference between prescribing and certifying is kind of different. So usually a physician would order a medication, you write a prescription, you put a dose down, and you say, take, your Paxil however many times a day for your depression, whatever it is. It's not the same thing for cannabis. For cannabis, I give the patient permission, or I certify that they can then go and purchase medical cannabis. And so I can give recommendations about what formulation is best for that person based on my experience and the research, and we can talk a little bit about that, the ratios of THC and CBD and the milligrams of each of those chemicals, but I do not actually prescribe that so we don't prescribe, we certify. So that gets tricky because then a patient is left going to a dispensary where they speak with a pharmacist, and that pharmacist then is guiding how much to give them, the amount of milligrams, and the ratios. And so a pharmacist at one dispensary may say something different than another. And so generally, I've built a trusting relationship with Jeff, Dr. Lombardo, and he is very skilled and knowledgeable. And then, of course, there's different dispensaries with varied experience. And so usually at Roswell Park, we do recommend, talking to someone who's an expert, and we have felt that, Dr. Lombardo is someone who's very experienced and skilled. So generally, it's something that we don't have a ton of control over as physicians. It's very different than a physician prescribing a drug.
So, I think there's some ideas that you have to have pain in order to be certified to get medical cannabis. But is that true? And if there are an other array of symptoms, what other symptoms would qualify someone?
So there's certain diseases in New York State that you need to have in order to be diagnosed with to then be considered for cannabis. And I think everybody has the handouts that we put out there. There's one of the handouts lists all the diseases. Cancer is one of them. Multiple sclerosis, ALF, there's different diseases that you have to have, spasticity, and then there's symptoms associated with those diseases that within New York State that a physician will have to, when they go onto the New York State website and certify somebody, you have to actually, me as the physician has to actually check a box to say this patient has cancer and they also have poor appetite, nausea, or pain. Those are the three main ones that people often seek. Uncontrolled nausea and vomiting, poor appetite, losing weight, and I believe on the certification it says cachexia and wasting syndrome, which is just a big word for poor appetite. And so people often get very worried about what does that mean. It just means poor appetite and that you're losing some weight, and that's associated with having cancer. And most cancer patients, often get poor appetites. So those are the reasons we usually give it, but there's many other symptoms like seizures in children and spasticity from multiple sclerosis and things like that other people may take medical cannabis for. Just at Roswell Park, most of our patients take it for cancer and for cancer-related symptoms.
So, Dr. Hansen, can you explain why medical cannabis is preferred versus recreational marijuana? I mean, it seems like a lot of the barriers of cost and accessibility and self-dosing are available to people with recreational marijuana, but can you talk about what the advantages are?
Yeah, so there are some important differences. I really feel for patients because we're in an unfortunate place right now where insurance will not cover the cost of medical cannabis because of the federal regulations. So it is quite expensive and more expensive than most other medications we prescribe. However, there's some real safety concerns with trying to use recreational marijuana that's not medical cannabis. So I'll describe medical cannabis first. Medical cannabis, they take the marijuana plant and they strain out hundreds and hundreds of compounds, and what you're left with is THC and CBD at different ratios. And you can have pure THC or pure CBD. But you're straining out hundreds and hundreds of other compounds that really are less well studied and that we're not sure in terms of safety or for our patients who have cancer in terms of the effects on their cancer, what those compounds may do. And so that's really important. It's also important because when you're buying recreational marijuana, you really don't know what the ratio of THC to CBD is, and you don't know what the dose is. And so when we're sending patients to get medical cannabis, we're able to get them a very specific dose of THC or CBD. And particularly for patients who are naive, have never used marijuana before recreationally, I think that's really important because there are side effects, and when you're using recreational marijuana, you're going to get much higher doses and more uncontrolled doses, and your risk for having the negative side effects is much greater. There also are risks with recreational marijuana that it could be laced with other street drugs, and so that's an important consideration as well. So, and then the last thing I'll mention is with the vaping illness, we're still trying to get a handle on the exact cause of the vaping illness. It does seem like the black market vaping cartridges are at higher risk. And so that would be the other consideration. We really are recommending that our patients stay away from all vaping devices until we get a better handle on things. But certainly with black market products, I think you're at even higher risk.
I wanted to clarify one thing that patients often ask me that I don't know if everybody's aware. Medical cannabis is not smoked, okay? So when you use recreational marijuana, you usually would smoke it. I know there are people who take gummy bears and all kinds of edible things and topicals that you can get recreationally. The gummy bears are very high THC to mimic the euphoria and the high that people are often seeking when they take recreational. But you do need, they have very, the higher the THC, the higher is the psychoactive side effects. So you can have psychosis, and if you are prone to mental illness or anything else like that, it can be triggered. And so you have to be really careful with any recreational products because they have traditionally much, much higher amounts of the harmful chemical, which is the THC. Although the THC is the key chemical you need, as Jenny pointed out, for symptom relief. So you have to get the ratio correct, and you usually need like a 1-to-1 ratio or a 2-to-1. And so recreational is often like 200-to-1, just to give you an example. So very, very high amounts of THC, which is often not what we would prefer to use for medical symptoms.
So a question for Jeff. Can you explain how the dispensary works? I mean, what people can expect once they are certified and come to you for?
So here in the Buffalo area, there's a dispensary here in Buffalo and two in Amherst. The most intimidating part when you first go to the dispensary is the security check-in. So New York State has various laws we're checking in. So it's the first time there and being naive to the whole setup. Going to an area that's security check-in could be the one that kind of gets you a little bit nervous. But once you come in the door to the dispensary, it really is a welcoming, warming environment. All the dispensaries have a pharmacist on staff. And you should meet with a pharmacist, especially for your first visit. I think the most important thing for that initial visit is that you give a complete list of drugs, medications that you're currently on. So as a pharmacist, one of the things that we're specifically looking for are drug-drug interactions. And with CBD, there are drug interactions that can be significant, especially for oncology medications. So filling the information out, giving a good patient history, meet with a pharmacist so they get an idea of what your symptoms are, and understanding if you're truly naive or not, talk through that and select the best product for you.
So what are some of those interactions between, because we're talking about oncology patients, what do those interactions look like? What could people expect? What should they do about it?
Yeah, so the drug interactions specifically, a lot of the oncology medications, especially the orals, are metabolized through the liver, specifically the cytochrome P450 system, 3A4 and 2C19 enzymes. So when you take CBD along with your oncology medications, your levels could go up or go down. Okay, so toxicity. So the oncologist needs to know that if a person starts on an oral oncolytic that has an incidence of maybe neutropenia, where your white blood cell can go down, if they're taking it in conjunction with a medical marijuana product that has a drug interaction, that drug level could go up. Okay, so it's not when you start, but how you progress on the medication. So the physician, and that's the relationship that we want to form, to give the physicians the information to know that and to monitor how the patients do while they're on therapy.
Do you think there's a stigma about coming to a dispensary? I mean, there's, kind of a stigma around marijuana use or recreational use, or are there certain types of patients that, are more uncomfortable with the idea of using it and showing up at your dispensary?
I think for us, once again, going through the security check-in is the hard part, but a welcoming environment, and I know in the Buffalo area at all the 3 dispensaries, the pharmacists are highly trained and well-knowledged. I think education is important, and I think, with the recommendations that they get from the physicians, it should be a welcoming environment for the patients. I don't necessarily see that, but I think they're coming there, especially oncology patients looking for information and some supportive care.
So do you find that most oncologists are supportive of their patients starting to be certified using medical cannabis?
I think it varies. I think that at Roswell Park, at least, we've been doing this. I started the program in 2016, back when New York State first, started using legalized it medicinally. And since then, I think that the oncologists, from the time I started till now, are seeing how well some patients are doing on it, so they really can't. They started off maybe being a little bit more resistant, and then as they see that some patients are really swearing by it, feel that it helps them, they're maybe changing their mind. And then there's other oncologists that are very open to that, so I guess it just depends on the person. I try to get the word out on some of the scientific literature that's out there, because in the last maybe 5 years, there's been a huge explosion of medical research on cannabis. So maybe 20 years ago, there was very few literature. And so if you hear your physician say there's no research, that's actually a very outdated thing to say, because in the last 5-10 years, there has been a decent amount of literature. It's just that we haven't had long-term studies, and we need more studies looking at side effects, dosing, drug interactions, because unfortunately there's still some unknown things about using medical cannabis.
So Eric, does using medical cannabis do anything for the cancer itself?
Yeah, so we do have patients come in who have read online and come in quite hopeful. And there were some studies quite a while back in Petri dishes that got people excited. But really none of that research has been translated into showing a positive effect in actual patients. And so, I do think it's important to note that for patients who are on some of the newer immunotherapy drugs. We still need to look into whether there may be a negative effect. And so I would say that there's really no good evidence that there's a positive effect for cancer. And if anything, we need to make sure that medical cannabis may not be interfering in any way with the neuroimmunotherapy drugs. Especially
with the interaction with the P450s in terms of metabolism and efficacy. Do you see research starting in that area?
So I think NIDA,
Okay.
NCI, Pandora's box is open. People are using these products, whether they're recreational or medicinal. And I think when we're looking at any type of drug product, the first thing we have to look at is safety, then look at efficacy. And to Dr. Hansen's comment, familiar with some of the abstracts that looks at IO therapy and cannabinoids with a decreased response rate, because theoretically, PD-1 inhibitors, immunological response, and CBD is doing the actual opposite effect. So I don't think we really know, and I think some research needs to be done further into that. One of the barriers is the federal schedule, the Schedule I license, Schedule I status. So if you have a lot of research dollars from NIDA or NCI or whoever it may be, there's that question of putting those funds at risk by doing research, then getting your protocol through the IRB with not a lot of human data and studies to support as it goes through the process.
Okay. So we're going to turn now to some questions that were submitted before the symposium started. So we've talked a little bit about that interaction of drugs that, especially related to cancer drugs, that you don't want to take at the same time. Are there some other drugs that you think either accentuate the effects or may decrease the effects, or there's an interaction that are common among cancer patients? I think it's kind of open to...
I've seen abstracts about tamoxifen.
Yeah, and so once again, going back to the pathway, enzalutamide and induction and lowering doses of CBD. Another classification of medications are the anti-epileptic drugs, Onfi. And so there's definitely a drug interaction there. Going back to the literature, if you're on a CBD and you give a very strong, potent inhibitor of fluconazole, which might be a normal drug to give patients with a fungal infection after post-transplant. In the literature, 400 milligrams 5 times a day, you can see a 78% increase in the area under the curve. So substantial rise in what the dosing should be. So they're significant, and I think what we need to do is identify them, then communicate with the physicians when they have their follow-up appointments with Dr. Case or Dr. Hansen to say, okay, this is a potential. Either lower the dose initially and make sure you follow the patient going forward.
Do you certify patients who are on painkillers as well?
We do. I think that some pain specialists are opposed to combining opioid medication, pain medication with medical cannabis because of a concern of, adding another controlled substance, both substances causing sedation. Like any other combination with any other sedating medication, I treat this just as one more sedating medication. So I educate all of our patients when we see them about the risks, and that if you combine an opioid with a cannabis, that you can have, some patients have more sedation. Usually we request they start off taking it just at night and they don't drive initially when they first get certified. And generally, we monitor them pretty closely. And when they're on opioid medications, usually they're pretty, we wouldn't start cannabis unless they're tolerating those medications pretty well. And a lot of people drive and work while they're on pain medications that we see. They're pretty functional. And so I don't really see a problem with that. If you're combining with alcohol and alprazolam or Xanax and some of these other medications that are being taken out there, then you got to be a little bit more cautious. The more things that you take additively together, you could be more sedated or impaired. So we just pay attention to all the different medications.
So Eric, with you probably see most of your patients who have undergoing treatment who have an existing cancer, but do you also think this is appropriate for long-term survivors who have residual symptoms of treatment?
I do. I think particularly for patients who have some of the symptoms that are difficult to medicate, like the severe neuropathies. This can be an effective medication, and often we're trying to decide whether to treat that nerve pain with opioids or with cannabis. And we do feel like there's probably slightly less long-term side effects with the cannabis than with opioids. And if I had to choose a patient being on one of those for years and years, I probably would prefer them to be on cannabis. So that definitely is a consideration.
So Ginny mentioned that she was referred by her physician. Is that required? Can people, call and ask to see you in order to get certified?
Yeah, in general, the supportive care and palliative care clinic at Roswell is based on a referral. But if you are interested, you could, reach out. There's a general number, Roswell Park hotline, and request a consultation with us. And so pretty much we could see you. Generally, the prerequisite is that you need to be a patient at Roswell, and you need to have an oncologist at Roswell. And then our clinic, you can consult any one of, there's 7 providers. We all prescribe medical marijuana. And, we have 3 nurse practitioners, 4 physicians that all prescribe. So we generally get people in, within 2 weeks, ideally. And if they're having a lot of uncontrolled symptoms, we can get them in the same day or within that same week. So we really try to cater to the patient. But the process, as Ginny outlined, is a little bit laborious as far as New York State's process.
Can I just say, they are so fantastic up in supportive care. I mean, no, really, they work with you, and I mean, cancer is scary. It's so frightening for everybody, and their hearts are so big, and they care so much, and they're there for you, and I just wanted to let you know that.
We give out a lot of hugs and love. And palliative care is not just medical cannabis. There's a lot we kind of hit you with, other surprises that you'll get along the way, but it's all good.
So I had a couple questions about whether it's good for digestion. You mentioned in control of nausea, chronic diarrhea from radiation. Are those some of the other symptoms that it's helpful with, or do you find that you use other treatments for things like that?
So I don't think about it helping digestive health in particular, or chronic diarrhea. So in my mind, the symptoms that medical cannabis has the best evidence to show that it's helpful for. So nerve pain, it definitely can be helpful for. Nausea, particularly when that nausea is from chemotherapy, it can be helpful for. There's moderate evidence that it can be helpful for sleep disorders. And there's emerging evidence that it may be helpful for anxiety, depression, and even PTSD. Oftentimes, the symptom cluster that patients have that seem to have the best response is a pain, particularly a nerve pain, that's keeping them up at night, making it difficult to sleep, and particularly if there's some anxiety associated with that. That really seems to get the best response. And then in appetite, quite a few patients seek it out, hoping it'll help with their appetite. There definitely are patients who come in reporting that they've had a significant improvement, but it's important to know that it's not everyone. So, did you want to?
Yeah, the only other indication outside of oncology or supportive care where there is some evidence is with epilepsy, okay, with certain types of childhood seizures, refractory seizures, and some of the multiple sclerosis patients who have spasticity. Now, some of those products aren't approved here in the United States, but in other countries they are, so spasticity and goes to with a neurological nerve as well.
There was one small trial that said that patients who had Crohn's disease, because CBD and THC are anti-inflammatory, that they had less Crohn flares, which I think is kind of interesting. And I think that actually I've had several patients with rheumatoid and types of connective tissue inflammatory diseases report to me that after taking it, that their pain from those types of pains get better, although there's not much evidence on that in the medical literature. It's just is all anecdotal that I'm hearing. We've certified probably in combination several hundred patients in our clinic, and we do hear a lot of people voicing back to us how they're doing, and so that's why Dr. Hansen and I are studying medical cannabis in our patients, and so hopefully we'll be doing that more.
Do you think the conflict with the federal regulations versus states having different laws, has that impeded our ability to understand, collectively to collect data on the benefits and drawbacks to medical cannabis? Do you think as laws change that we'll be freer to start to really collect data? I mean, not just to do studies, but to really, have it in EHRs
Yes.
to collect, combine that information.
Yes.
Yeah.
It's been very restrictive.
Which we would do
Prohibitive.
for any pharmaceutical that we're giving out.
Yeah, I go back to drug development. What we do at the university is we have to prove safety. We have to prove dosing, and we should do that with drugs that will be FDA approved through the process that we have in place. So, animal models, pharmacokinetic studies in healthy volunteers, multiple dosing, then the clinical trials. That's the process that we have, and NIDA is open to that. And you look at some of the grants and some of the funding that now is being introduced, they want to do that. And I think Roswell Park is in a great position to do that with the palliative care team and the number of patients that they're certifying, and getting that information and a connection between the physician's office, the dispensary, and how that patient does. And that triad of patient-reported outcomes and how they do. Then I think we have to measure it. We have the ability to measure, certain concentrations, on a curve, and try to figure out what is that appropriate dose.
So do you think it's addictive? Or is if it's relieving symptoms, that may kind of be a little bit addictive because you want to keep taking it because it's working, but is it addictive like other pain?
Medical literature does not point out an addiction potential for cannabis. However, some people do, when they're using it recreationally, seek to kind of dull whatever emotional pain they may be having. So I've had some patients who are smoking marijuana constantly all day long, and so that person might have lots of vomiting, and actually they'll have these strange paradoxical reactions where they could have a lot of harm from overusing it. So in smaller doses, it could be quite helpful, but then if you overdo it, it can be pretty harmful. And so we do see people who use it compulsory, and so it has the potential for that to happen. But the people who use it medicinally or just once in a while, I do not see that withdrawal that you might get on from stopping another drug. So the definition of addiction is when you're psychologically dependent on a drug. You need it in order to function and for your mood, and you crave it and you'll do whatever it takes to get it. Whereas dependence means if you're taking it, if you stop the drug, you'll have withdrawal. You don't get withdrawal from cannabis, and you don't necessarily have a major psychological craving for it like you would like heroin or crack cocaine or some of these other very addicting illicit drugs. So it's much more mild when compared to those drugs.
So one of the questions was the long-term use of CBD, and then I would also add in medical cannabis. Does it stop working after a while? Do you develop sort of a resistance? Does the dose need to be increased? What does sort of that look like in terms of long-term use? Do you want to answer that?
I think the jury's still out in regards to long-term use. I think CBD, and we have a product that's FDA approved in the epilepsy space right now. When you start, one thing that we know that we have to keep an eye on are liver function tests, because it can elevate some liver enzymes over a period of time. So we have to monitor that. And CBD in general, we don't know what the appropriate dose is. There's a big window. versus THC. So as you titrate up, milligram per kilogram, you may have more side effects, maybe sleepiness, drowsiness, lethargy, something that you work with your physician to overcome, and we'll see long term. It's been used recreationally for various indications for a very long time. Maybe not reported, but to me, we'll have to see what the data comes in, but it has been used for a very long time with not so many or any really reported documented fatalities with it.
And there is a drug that's a synthetic THC that's on the market that's only THC called Marinol, that we have been known to, it's covered by insurance. Taking it alone is pretty bad. Don't recommend that at all. But, we've been known to prescribe that in combination with CBD, which is much cheaper than getting a medical marijuana product from a dispensary, which runs around $80 to $130 for a once-a-day dosing, and generally the oral products last about 6 hours. So if you wanted coverage all the time, you'd be taking it twice a day at least, if not 3 times. And so we're talking, multiplying that times 2 or 3 in order to get.
I just started to take that in the evening, before I went to sleep, and it really helps. And it's so much less expensive than the medical marijuana that you would get at a dispensary.
So I'm going to go back to the cost and, how to advocate for insurance coverage in a minute. But I want to stick to, one of the questions was about a person who's taking medication for depression. And can, this be used to help taper some of those meds? And if so, how is that coordinated with the care team? I mean, do you communicate with the prescribing psychiatrist, or how does that really work, and how do you communicate with each other if you have to change the dose? Or they need liver tests? So how does it all get coordinated with the other providers?
Sure. So specifically for the indication of depression, I would be a little hesitant to wean someone off of first-line medications for depression that have been shown to be effective. Solely trying to use medical cannabis as the replacement treatment. I don't think there's enough data to justify that. I think that medical cannabis could be used based on the emerging data as a supplemental treatment, probably a little bit more for anxiety than for depression. But just to kind of clarify that recommendation. In terms of communication, that's something that's still being worked out. And part of it gets to what Dr. Case was describing earlier, which is the certification process for medical cannabis is completely different from any other medication we prescribe. So with any other medication, we're writing out an exact dose, and you're going to CVS or Rite Aid to get it filled. And if there is an issue, the pharmacy is calling us. And there are pretty well-established pathways to make that happen. When we certify patients for medical cannabis, they are then left with the option of going to any of the dispensaries. Here in Buffalo, there are 3. And the communication is less well-established. And so I really have to encourage my patients to call me when they're initiating, with any dose changes, with any side effects that they run into. And I think we've talked about trying to improve the communication lines between the medical cannabis pharmacist and the treating providers. But right now, it's really up to the individual providers to make that communication happen.
And then when you're certifying someone who is on a medication for anxiety, and you're hoping to maybe help the anxiety with the cannabis, which actually some people get a great benefit for anxiety and sleep, and they may be able to come off their Ambien or their lorazepam or Ativan, whatever. We would communicate that with the psychiatrist or the primary care physician, the same way we would if we were starting any other medication, usually a phone call, an email, or something through the electronic medical record. So
Are there
that usually gets
Are there
communicated.
standard lab tests? I mean, if someone's taking medical cannabis, do you routinely do liver enzymes? Should people expect to have that on top of their regular testing for their cancer treatment or during their monitoring?
People at Roswell Park generally have a full lab profile when we see them. So anytime we're initiating any medications, we always make it a point to review all the labs and look at whether or not the liver tests are up or any other abnormality in the labs. One thing to note with medical cannabis, there are some, is it okay if I talk about the contraindications as why you would not want to take it?
Yes, please
There
do.
are definitely very important reasons why you would not be able to take it. So there's been people seeking this that we've actually said we did not think they were a good candidate. So somebody who has schizophrenia or a history of psychosis where they hallucinate or have depression or manic depression or bipolar disorder, where they've ever had in the past, psychosis, meaning that they're hallucinating, seeing things that aren't there, or very, very bad, uncontrolled mental illness. This is actually, the cannabis could make this worse. Another thing that it can do is if you have cardiac disease, heart disease, with a fast heart rate, it can cause the heart rate to go faster. And so it can affect the blood pressure as well. So we generally want to look at the heart and look at the medications someone is on for the heart. So like any other drug, as physicians when we're certifying, we look at the whole patient. We look at all of the medications they're on. We do that with any other drug. We look at the liver, we look at the kidneys, and we make a call whether we think this is a good idea or not. And then we'll talk about that with the patient.
So, Jeff, you mentioned that the horse is out of the barn in terms of even in an environment federally where this is not, approved, that we're starting to prescribe it. So the advocacy for getting insurance companies to start to pay for this, it's kind of a tricky situation. And what's being done about that? And for people who are using it, who it's successful, what can they do to encourage changes in this coverage?
Yeah, so it's a high hurdle, I think, to overcome right now, especially with the Schedule I status federally. Insurance companies do not have to recognize that for payment. I have heard of some isolated cases in regards to workman's comp, with long-term opioid use, and there are, once again, I haven't seen it, but some workman's comp cases covering if there's a certain threshold spent per year. It's a political argument with politicians, keeping them informed and having them advocate. And I think when the schedule status changes, if it changes and when, then having the studies to support it's once again its safety and efficacy and FDA approval, then in my eyes that's going to be the pathway in order for it to be covered by insurance companies right now. It is expensive, especially if it works. Some patients will spend, if they have to have high doses of CBD, they could be spending $700, $800 a month to treat. So it could be expensive. There are some alternatives now with the passage of the Farm Bill and some of the CBD-only products, full spectrum, that are outside of the program. That is maybe a way to go to save financially. And so there's ways to do that now with the Farm Bill, with CBD-only full spectrum products, along with if you need a little THC from the dispensary, that's probably the way to do that.
So we're getting close to finishing up. I wondered if you wanted to sort of go down the line with a little summary of other points that maybe we didn't cover that you want to get to our audience. Start with you, Amy.
I think you're all here because you're interested in this and maybe not so concerned about the stigma, but I think that it still is something that is quite stigmatized, and I've been nicknamed Dr. Pot, and I swear to God that's not my name. And I really don't love that because, I actually think this is a really good drug. And I do palliative care, so a lot of the patients I see are quite ill, and I've seen a lot of great improvements in symptoms that I was not able to palliate before starting. So I have a very strong positive association with this, and I think that we need to get rid of the stigma. We need to separate it from the recreational. This is a drug. This has side effects like any other drug, and smoking pot to get high is not the same thing as this. What we're talking about here is a controlled drug that we're giving for symptoms. Smoking pot to get high is a whole other political argument that we are not here to talk about tonight. And so the thing that irks me the most is they think that I'm all about, here you go, have a joint. And that's really not what this is about right now. This is about medicine, and this is a drug that actually does work. So that's all I'm going to say right now. But it's not smoking pot, okay?
Eric?
So for patients who are considering trialing it, I would say start low and go slow. And we have quite a few patients whose initial experience is not positive. And I think the temptation is often to say, well, cannabis didn't work for me, I'm going to move on to something else. And if you're working with a provider who has some experience, you may find that with changing the ratios, changing the formulations, you may actually be able to see some of the benefits. So I do think it's really important to try and seek out an experienced provider. Not everyone has a positive experience with cannabis, but I think if you're doing it in a more controlled way and with someone who has some experience guiding you through, you're more likely to get the positive benefit.
Reiterate what Dr. Case had mentioned. I mean, it is a drug, and there are drug interactions associated with that. And with Dr. Hansen, also echo that, start low and go slow. When you meet with your pharmacist or your physician, give them a complete medication history so they have a picture of how your journey forward would be. And, as Eric had said, 10 patients go on product, 3 will go this way, 3 will have a response, 3 might be negative. And we didn't talk about the various combinations that are out there and the whole profile that's available, whether it's CBD or CBG or CBN or a lot of the cannabinoids we don't really know about. That may be beneficial, and I think as the research continues, what may not help individuals with cannabinoids right now may in the future. Mm-hmm. And once again, experts working with Dr. Case and Dr. Hansen, what they do is very important as well.
Ginny?
As I said before, it's really, really helped me. It's using it has allowed me to do all the things that I love to do, without all the achiness and just feeling yucky. It really helps. And Dr. Case and Jeff has really helped me navigate through that whole journey of what works and what doesn't and the expense of it. So it's really something that's been a very positive experience for me.
So just before we close, can you say how they can find the dispensaries? What do they look up? What website to go to?
Yeah, so the New York State Department of Health has a very good medical marijuana website. Mm-hmm. Roswell Park also has a link with a lot of information as well. So you can go on there. And once again, there's one in Buffalo and 2 in Amherst. And all 3 of them have knowledgeable pharmacists. I know all the pharmacists that work at all of them. And you can always call Roswell Park for a referral as well.
Do people want us to talk about the actual products and what's available in New York State? Because I think sometimes there's questions about that. Did you want me to touch on that really quick?
Sure, you got a couple minutes.
There's oral pills.
Yep.
There's oil that you can take orally, so anything that you eat, like pills or oil, is longer acting. And then there's vape products, which you get in a cartridge and you inhale a mist. And that vape is short acting, so it's not going to last as long. So we use it often more for nausea or quick things that come on, but for chronic pain and some of these other symptoms, we prefer more of the oral. And then there is powder now, and I know some topical formulations. but there is no smoked form.
So when you go to the dispensary, you kind of have options to choose from in terms of the form.
Yeah, so in New York, the New York State, they classify it as an equal ratio of 1-to-1, equal CBD and THC. The other way is a high THC, low CBD, high CBD, low THC, and various variations of strength. So it can be a little confusing. So once again, first time going in there, don't hesitate to ask for the pharmacist or one of the technicians. They'll be more than happy to explain the products to you, and there's even some strains that looks at various strains, whether it's a sativa strain, hybrid, or an indica. The jury's out as far as the effectiveness or the conditions for that, but that also can be confusing if you're just being exposed to that for the first time.
And there are, elderly people or frail people can try these. And generally, like Dr. Hansen said, start low, go slow, but generally a 1-to-1 THC CBD ratio is probably the most conservative and safest with the least amount of side effects. But I have had, a few patients who were given a very high THC product by the dispensary, and one of them, had a car accident. And this was not something that I was real happy about. But again, it was out of my hands. They went to the dispensary and they got a high THC product. And their adult children were driving that because the adult child thought it would be better from, their father, who was 70 or 80 years old, to have a high THC product. But the issue with that is he couldn't tolerate it. He was loopy and confused and crashing his car up. So there are issues. When we converted him to a 1-to-1, he did just fine.
So again, if you're a Roswell patient, you can get a referral from your oncologist, or you can self-refer to come to your clinic. If you're not a Roswell patient, and where do you go to find a physician who can certify you?
New York State Department of Health has a searchable website with directory of physicians choose to be listed on the website. You can go onto there, put in a zip code, and it will show you where to find a physician to go for an evaluation and possible recommendation.
So I want to thank you, the panel, very much for giving us so much information. I want to thank the people who came, the people who are online. This has been really a great and informational session, and we encourage people to keep asking questions and to advocate for coverage for this drug. So thank you very much, and have a great night.